All right, hello everyone. Thank you for taking the time to join us live, if not in person, at our second installment of Data Literacy in the Wild. Tonight we're going to be taking a look at a couple of public health data sets and explaining why we think public health, just as a category, is really a useful field to help teach students the basics of data science. I'll let Aaron introduce himself because I can never quite do him justice. Aaron.
Sure. I'm Aaron Reedy, one of the co-founders of Data Classroom. I started my career in education as a high school biology teacher in the Chicago Public Schools. I taught for 7 years, and then I left to pursue a PhD in evolutionary ecology. And it was while studying for my PhD that I started working on Data Classroom to solve a lot of the problems that I had previously in my own classroom in getting students to work with data. And so that's what we do here at Data Classroom now is make tools for learners in grades 6 to 12 and now university as well, who are learning to work with data.
I'm Blake Blaze, for those of you who are tuning into a Data Classroom webinar for the first time. I'm the Director of Operations / Jack of all trades at Data Classroom. Before joining, I was a cyber intelligence officer with the United States Navy, and before that was a high school math teacher, and now I get to kind of put a little bit of my math skills and some of my technology skills into practice with Data Classroom. And so a quick outline of what we'll accomplish over the next 45 minutes or so. Quick welcome. We'll talk about a little bit more in depth why we are using public health as a frame to teach data science. The cases we're going to take a look at include an example highlighting Florence Nightingale, who was a nurse during the Crimean War in the middle of the 19th century, the impact of the COVID-19 pandemic on the opioid epidemic in the US. And if we have time, we're going to take a quick look at a data set called The Cure for COVID, where we take a look at some research by University of Minnesota scientists studying the impact of hydroxychloroquine and its effectiveness in treating COVID. So here's a link to the data sets. It's more relevant when we send these slides out, but should have mentioned earlier, if you want to follow along, we'll share the data sets in the chat as we go. And so if you want to take the time to start a Data Classroom profile or log into your existing one, you can follow along as Aaron and I go through some of these data sets. So first, why are we focusing on public health? In the Virginia Data Science Standards of Learning, they identify 5 strands of teaching data science. And while this isn't the be-all end-all to teaching data science, it is helpful to organize our thinking in how we communicate the important aspects of data science to students. And those 5 strands are context, literacy and bias, data communication, data modeling, and data computing. We think public health is especially useful in teaching the first 3 of these strands, because context is the importance of identifying real-world examples for students. It makes it apparent the need to use these data science skills, and it allows them to be practical in applying them, because the whole point of data science really is to apply it to real-world contexts. Next, literacy and bias is focusing on using the context, building on that context to create solutions. I think we have a hot mic in the crowd.
Yeah, I think
so again, the literacy and bias piece, we're empowering students to try to derive solutions from their analysis. And also really important, especially in the field of, when we're talking about public health and medicine, is identifying possible biases in the data, understanding how the data were collected and how that might impact our analysis of the data. And the third one that we think is especially prevalent in public health is the importance of communication. Students need to be able to justify the visuals and then use storytelling to communicate their data. I had a high school statistics teacher who would say that statistics was the art of turning numbers into stories. I think that's just as true for data science, and something that's really powerful when you give it the frame of medicine and real-world examples. And then we hope in the course of investigating these examples that it's clear the ways you can use data modeling and data computing in your classes. Here's a quick list of all of our public health related data sets. Again, this is more for when we send the slides out after today's presentation. We're going to try and hit the first 3 in this list. All right, so the story of Florence Nightingale, here she is, 19th century nurse and data science extraordinaire. Here's Data Classroom's rendering of her as a slightly happier individual. So she was phenomenally important in data science pioneering because of her work studying mortality rates in field hospitals in the midst of the Crimean War. And as we go through this data set, we'll highlight a couple things, including the importance of tidy data format, what happens when you begin your investigation with a visualization, how that leads students to be able to find insights they might not otherwise, and then tying it all together with some descriptive stats. So some context before we jump into this data set. During the Crimean War, the mortality rate was as high as 40% in field hospitals.
Wow, that's astounding.
And at the time, there was very little in the way of guidance on how to organize these field hospitals, in part because even the chief medical officer of England, John Simon, believed that infectious disease was simply unavoidable. And so there was no need to worry about arranging the soldiers or sanitization or spacing. And that's where Florence Nightingale comes in and really just thinks that this is unacceptable and tried to put numbers to use. I'll turn it over to Aaron, who'll take us through the data set and just exactly how Florence Nightingale ended up changing the field of nursing.
Sure, and yeah, we'll look at this data set in a second, but I'll say that we went back to Florence Nightingale's original notebooks because they've been scanned and they're all publicly available online. And so we looked for these data for a while because we were familiar with the story and its role in just sort of data science lore. And so we were looking around for it. It was just a really cool surprise to be able to see the scanned pages of her original data notebooks, and that she used to present her findings with. So that was really fun, and had the pleasure of working on this with a UVA undergraduate student who assisted quite a bit in developing this. So I guess with that, I will share my screen. And so Blake, this is going to take away your screen share. And I'm going to hop over here. Didn't have the smooth transition there, but I'm logged in into Data Classroom over here. And what I'm going to do is I'm just going to pull the Florence Nightingale data set from the resource library. So if you're following along, you can go to the resource library either from this big button on the dashboard or up in here. And I think Blake is probably giving you a direct link in the chat. But in the resource library, I just did a slight update to this data set, so it will be in the upper left position, but you can search for it in the free text search in the upper right if you're looking for it. If you put Florence in, it will pop up. But I'm going to open the data set here. And hold on one second. There we go. Okay, so I have opened the data set here, and I'll just simplify this. So just looking at the data. The data set consists of these 5 variables. We have the month of the year that the data were recorded in, and then we have the year the data were recorded in. And it looks like we've got data recorded 1854 to 1856. We have cause of death, and then for each of these, so it's broken out by cause of death and by observation, and we have a monthly death total for that observation, and then we have that transformed into a rate with what that would translate, that monthly death total, what that would translate into if it were presented as an annual mortality rate per 1,000 soldiers, just to control for the different numbers of soldiers that were on the battlefield. I'm going to also open this as an assignment tab. So again, what I did to do that, we're looking at the table tab if we're up here on the white bar, and then there you see the assignment tab, which I've now opened in a separate browser window, and this is the student facing assignment here. And so we can see there's some background information, and the high points of which Blake went over with his slide. These data it was around 1856, or it was 1856 when Florence Nightingale arrived at the British military hospital in Turkey. and looked around and saw, this death rate of more than 40% in the hospital. Within 6 months, her and her team of 38 nurses decreased the death total. It was down to about 2% as a mortality rate within 6 months of them taking over and making some pretty major changes to sanitation there. So this is the student-facing assignment, and in this assignment, students will look at the data that Florence was looking at, and then they will draw some conclusions from that, and then they will also compare that to the data visualization which Florence Nightingale pioneered, which is this coxcomb plot. And it's basically like it's kind of a two-dimensional pie chart, or really almost three-dimensional, where you can see a representation of sample size by the size of the pie wedges. And then you can see the categories broken up by the colors within each pie wedge. So the wedges in this case, I can't remember if they're different. I think they're different months, but you can do it as different months or different years. And the causes of death are broken out by the different colors. But to go to this data set in Data Classroom, I'm going to start plotting this data. And Blake and I were down in Palm Beach County, Florida last week, working with teachers in Palm Beach County schools down there. And they have a framework that they're using where they're trying to get students to both describe data and be able to explain data. And the way I like this framework is very similar to what I've done in a lot of times when I'm explaining data analysis to different students. But describing it, we're talking about it really just in terms of numbers. These are where we're talking about the trends in the data. We're talking about differences between groups. And then when we're explaining it, we're talking about, well, what does this mean? Given the real world context that these data were collected in, what is the explanation for this description? And so we'll first just focus on describing these data. And so what we might plot here, we might plot, say, this monthly death total. And so we'll plot that. And each dot that you're seeing here is a different monthly death total. If I hover on there, I can see the values for what that monthly death total was. But this is all the observations over that 3-year period that we have just all lumped together. What I could do now is I could split them out by some other variable. Like, for example, I could split them out by year and look at them and see what the monthly death totals were in 1854, in 1855, in 1856. We can see those totals that way. But we could also look at these by cause of death. And so on X, I'm switching out year, and I'm just doing this at the control panel at the right, and I'm putting in cause of death. And we start to see a picture emerging. And if we're describing this in terms of numbers, we can see that all of the values for all other causes, they're clustered somewhere around here, maybe around 50 to it looks like under 200 deaths is this big cluster, with a few high points in 361 or 324. Very similar story for wounds and injury as a cause of death. But when we look at infectious disease, we see a lot more variance on there, and going up to just a couple of months with really high totals, where 1,700 deaths, 2,100 deaths, 2,700 deaths. And if we even wanted to describe this, we in a little bit more mathematical terms, we could describe where the mean is for each group. And here we're looking at mean and standard deviation. The standard deviation also gives us a way to describe variance, and we can see that the variance is much greater from infectious disease as a cause of death. We could also look at instead of using standard deviation for error bars, we could look at it with 95% confidence intervals and see that it looks like clearly the mean value, even when taking into account how much confidence we have where that true mean would lie, it looks like infectious disease is quite a bit higher as a cause of death than when comparing to the other two. I tend to like for these data, I like data that are kind of non-normal like these. I really like box and whiskers plot, where the box is the interquartile of the data, or the middle 50%, and the line in the middle of that box is the median. And so you can clearly see a higher median value for infectious disease there as a cause of death. So that's the description, right? That's what we're seeing. We're seeing one cause of death that is much greater than the others. We can also dive into that and say, well, the numbers of soldiers were different in different months. If we control for that and look at that as an annual mortality rate is calculated from that monthly death total. So I'm going to add annual mortality rate and look at that. I'm going to do keep cause of death on X, and I'm going to change out Y instead of monthly death total. I'll do annual mortality rate, and you can see the figure hardly changes at all. We can also look at the graph that I sort of inadvertently put up there for a second. If we look at monthly death toll and annual mortality rate, we can see that that's very correlated as we would expect. But I'm going to go back to cause of death on X and mortality rate on Y to compare those, and we can see that. I see a question in the chat about outliers in box plots there. Feel free to ask a little bit about that. I would say I like box plots because they at least this style of box plot shows you where the full range is. So it even sort of makes some of those outliers a little more apparent by giving it that extra tall whisker. And so, you can see these 4 points that are, way above the interquartile range there. Did you have a follow-up question about outliers in box plots?
Yes, this is Chris. Can you hear me?
Yes, loud and clear.
Okay. From my perspective, the usual thing with box plots is to drive the whisker up to the last data point that's not an outlier, and then you'd have just the dots for outliers. I was really wondering whether that option was there in
that option is not there, and it is something we could consider, and I've seen it, like, I don't know if I've used a lot of different statistical programs, but if you've ever used Prism, there's an option to do that in there, and there's some conventions where you can have the whiskers go to the 90th percentile, and then anything above 90th percentile is not shown. I actually think it's a much better practice to, if you're including outliers in that calculation of median, then my personal feeling is they should be represented on the plot then. Because it's, I could hide dots altogether if I wanted, and just show my box plots without the data points. And I feel like when I see a plot that's like this, where the whiskers represent, up to the 90th percentile or the 80th percentile or whatever cutoff you've given it, I think that it can hide those outliers and sometimes make for a prettier story, but sometimes I think it's hiding some important reality. So I favor this, and the reason that this is the setting we have available in Data Classroom is because I think it's really good practice to show those measures of central tendency, like a median and a mean, as well as the raw data, because nothing can hide here, and you're sort of letting the viewer themselves decide, like, how much is that measure of central tendency skewed by the outliers, and they can see for themselves. Yeah.
Thank you.
Do you have a do you sort of like, is the outliers removed from a box plot like a hill you're willing to die on? Is that like a strong?
Well, I think the standard box plot would use the outlier criterion of 1.5 IQRs,
Mm-hmm.
and then the whisker goes up to a certain point, and whether you have the dots or not, the outliers would be indicated with dots, and the whisker would not go up. You'd have the option, I guess.
Mm-hmm. And I guess with that, it always gets into a question then too of like, what is your threshold for setting as an outlier? And like I said, I've seen a number of different visual representation of that. And what do you consider an outlier or not? Personally, when I in my own work, and granted, I didn't work with public health data, I worked with natural selection data in lizards. I never removed an outlier from my data set unless I had reason to suspect that number that was recorded was sort of inaccurate in some way, like something was wrong with my measurement or something like that. In all other cases, I would like to include those outliers, and if I excluded them, I excluded them 100%. They were not if they didn't appear on my graph, they didn't appear in my analysis.
Yeah, no, I agree with that. There's no I'm very hesitant to remove them, but I think the question is just how far above the third quartile would the whisker go? I mean, you'd still leave the dots there if they were outliers. You're not excluding them.
But it's just whether it ended somewhere around like 600 or 450, or how far up would you extend it?
Chris, I appreciate you asking the question, because there's kind of an interesting outlier here in that the topmost dot is above 1,000 deaths per 1,000 soldiers. So I would want to, I think that would be interesting to how you choose to highlight that, because that could be that the disease was so infectious that there were people maybe outside of soldiers being brought into the field hospital who were dying, or maybe we just didn't transcribe Florence Nightingale's 19th century journel accurately.
I have to say, I've never actually noticed that, Blake. We will have to go back to the journal page and see what is up with row 10. I've never actually noticed that. Good catch. We'll have to see if we need to add some kind of explainer to that, or like I said, it's possible we made a mistake.
And Aaron, would you mind? I don't know how much more you want to demonstrate in this data set, but would you mind if we overlaid month as a?
Yeah.
I would love to see if the infectious disease death totals were higher in like the summer months.
So looking at months, and we have here.
You have the group by Z.
Yeah, we have these grouped, but if we're just, you're right, just color coding by month, do we see these really high death totals, March, December, February, and a January? So those
don't get wounded in the winter, it sounds like.
I wonder too, wait, I want to switch really quickly and just look at the years for those. And no, it wasn't just the same bad year, because there was 1855, 1854, 1855, 1855. So 1855 looks like it was a bad year, but this one was, 1854. It looks like also one of the high values was from there. And then it looks like there's a cluster of 1854 down there. And then, what's the green? Green is
that makes sense, right? Because the infectious disease would be worse when there were more wounded in the field hospitals, right?
Yeah, I would think so. Greater density in there. Yeah. Well, cool. Okay. Well, with that, I guess that's the main story with this data set. We did the describe what was going on, and then the explanation is that infectious disease is really a killer in close quarters in a hospital. Do you have to manually set up the color for each month? No, you do not, but you can. And just to answer that, how you do that, if you wanted to go over to this variable of month, and you can see I'm hovering on this little box that says values. When I click that, it will let me go in here, and just when I added month, it auto picked colors, a range of colors. But if I want to go in and custom pick my colors, I can do that. I can go in and make April this dark orange, and I can make May a bright green. So I can go down the line and pick custom colors. I can also change the order with which these appear on the plot with these up and down arrows. So if I wanted to put these in a different order, I can move those up if I was doing some graph where that really really mattered there. So okay, and with that, I'm going to jump out to a different data set entirely. I will discard my changes here. And we're going to go and we're going to look at one a little bit more vastly more modern, I guess. We're going to look at this data set, which is called Epidemic in a Pandemic. And
while you're pulling that up, Aaron, I can share some of the context with this one too.
yeah, and maybe here I'll let you put up your slide and let's get the context behind this one.
So this one is a bit more complex for students than the Florence Nightingale data set. This was taking a look at the impact of the COVID-19 pandemic on the opioid epidemic. So in the course of the data set, these are some of the principles we're going to investigate using graphs to drive questions, adding a categorical variable to clarify, much in the way we just did with Florence Nightingale. And then we're going to showcase the benefits of iterating through multiple graph types. So the context that we need to know before going into this data set: there's a drug called naloxone that different states make available to drug users in order to help them avoid using drugs and avoid overdoses. This drug is available at public health centers and requires you being able to travel to the public health center and to consume it under the observance of a medical professional. Another kind of background fact: overdoses, especially with regard to opioids, tend to occur more when drug users are using in isolation, which ended up being one of the side effects of the stay-at-home order that was enforced on March 20th, 2020 in the state of Kentucky in response to the rampant spread of COVID. So public health officials knew that these stay-at-home orders might have an adverse effect on drug overdoses and worked really hard to study what the impact would be. That instead of doing the impossible task of accounting for every single drug overdose that happened over the course of the spring and summer of 2020, they used emergency medical services, EMS, runs with refusal as a proxy for drug use. Runs with refusal are the types of EMS calls where someone is treated at the scene but opts not to go to the hospital. And this is a really reliable proxy for drug overdoses because it's typically people who overdosed who don't want to go to a hospital for fears of withdrawal, treatment, law enforcement, and cost. And so public health officials used this data and this context to conduct a really important medical study.
And if I'm remembering correctly from the paper, it's been a while since we wrote this activity, but if I'm remembering too, it was also the emergency medical technicians indicated indicated that it was consistent with drug overdose, but the patient refused transport to the hospital. So it was relying also on the expertise of EMS, who I'm fairly certain, if they report that this was a suspected opioid overdose, they're almost certainly they got that right there. So with that, yeah, I guess I'll share my screen again, and we'll go into the data set. Blake's going to drop the link into the chat if you want to follow along. And I've gone into the resource library and grabbed this data set. So this is epidemic in a pandemic. We've got these four variables, which there's date, which we've converted into we've coded it as an informational variable, meaning we're not going to plot it due to some of the mathematical difficulties with graphing dates. But what we have done is we've converted this dates into a day. And so this variable called T, and the units are day. And we started at day number 1 was January 14th, 2020. And we go up to, how many rows are in this data set? I can't quite remember there's 104 rows in this data set. So we go up to row number 104, or day number 104. And then for each date, there's an observation of how many daily EMS runs with refusal. And then we've also categorized each of these observations as either being before March 20th, 2020 or after March 20th, 2020. This was again when COVID restrictions went into place within Kentucky. So I'm going to jump over to the graph and we'll start kind of working through these data. So one way we could look at these data, we can look at plot daily EMS runs with refusal just to see what, what the kind of range is here. We can look at these as a dot plot, and, we can see we don't have any days with no EMS runs. So the lowest daily total is 1. And we can see in the highest, there were 14 across the state. We could look at these as a histogram too, if we wanted, and sort of see what the distribution looks like here. It's a little bit non-normal. We've got kind of a skew shape here, but we have kind of a peak where on more days there's 4, 5, 6 or so EMS runs, and there's some range about that with tails going up to up toward 15 or down toward 1. I'm gonna look at these data in this box plot form a little bit more. I'm gonna look at these first across time. So I'm gonna add this time variable to X and see what the overall trend is here as we look at this. So looking at these data across going from day number 1 to day number 104, we see variation around there. There's a lot of variance from day to day at any point in the data set. I'm going to first add a regression line just to take a look at the trend of overall. And we see, I would describe this as we see an upward trend where over the time that was studied, the average or predicted value for EMS runs with refusal increases. But we see a lot of noise around that data. The R squared value is 0.306, which means that like the change over time explains roughly 30% of the variance that we see in the data, but 70% of it is mathematically explained by other factors that aren't here. And I think that probably makes sense when you're studying something out in the real world. It's very unlikely that you would stumble upon the one variable that's going to perfectly predict the number of drug overdoses on any given day. That's just, humans don't work like that, especially given the context of these data. But so I'd say that's a pretty strong predictor, with some noise around it. But as you're diving into this, you can describe these data by looking at other variables. So one thing we could do, we could add this before after March 20 variable to the plot. And so I'm going to first add that, and we can see it color coded. And so we can see that, before after, there's obviously this dividing line here, somewhere around, I guess it's day 67, looks like the first day that is considered after, and day 66 is the last day that's considered before. And so we can look at the data in this way, but I think it's really interesting when we look at this upward trend that we were describing when we were just looking at 2 variables. When we group by this third variable, and I'm going to check this little box over here to group by Z, and look at the trend in this way, where there's a regression fit for each group of data. Well, now I think the description is, well, we've kind of broken these data into 2 mini data sets, and the trend within each group, the trend within before and the trend within after, these lines are virtually parallel to one another, indicating that there isn't really a change over time when you're looking within these 2 periods. And so, describing this, you might say something like, well, in the first group, the before, there appears to be, no trend or change over time in the average, the number of runs, the predicted number of runs, as well as in the second group, in the after group, there's no change. However, the after group has a higher y-intercept, right? There's a difference in the sort of predicted value in that group along the entire length, from day 67 to day 104 is higher than it is in the before group. So this reveals a different trend. Now, explaining this, I think, the variable itself is inviting explanation of, well, this was we could make some hypotheses about increased isolation, leading to heavier drug use, leading to more drug overdoses. And, clearly these data support the idea that the increased isolation following the COVID lockdowns had a negative effect on people suffering from drug addiction.
And Aaron, just thinking about some of those strands of data science and communicating the story, what if could we represent the before and after as the X variable?
We could, yeah. And this is also a great way to illustrate that there's no one right analysis when working with your data. And so if I go ahead, I'll get rid of that before and after on this, and I'll make before and after my X variable here, and we can look at the data in this way, where we can see the variation that occurred in both of those time periods. And this is also a great way to see there's definite overlap, right? You couldn't just say which time period am I in and perfectly predict, what the number of overdoses was going to be. There's a lot of range in there. And if we could add descriptive stats to that, like, we'll maybe do mean and 95% confidence interval. And we can see that, the average value in the after group is somewhere over here above 8. If I look at the values, it's 8.263. And the average value in the before group is 4.41. So another way you could describe these is saying that, the mean value for suspected drug overdoses in the after group was basically double what it was in the before group.
Yeah, I think important too is how you really require both of the graphs to tell the story, right? Because you need to explain away the impact that change in time may have had on the overdoses. So the fact that if students can quickly iterate through graphs, they can see the whole picture more completely.
Yeah, absolutely. If you presented this to me first in isolation, you'd immediately say, well, wait, was there any trend in time? I know you have time series data, what was going on with time, and you would want to know what that is. So you'd want to see that sort of regression type analysis first. Yeah. Okay. Are we going to go into our third data set? If anyone has any questions on this, we can stay on this one a little bit longer. Okay. Well, then Blake, I'm gonna turn it back to you, and you can give us a little context for data set number 3.
Sure. So I'll emphasize, as we leave that data set, these are really serious topics, and the challenging part for students is contextualizing and communicating the data sets appropriately as well. This last one, very proximate. We're going to take a look at a study done by University of Minnesota scientists analyzing the effectiveness of hydroxychloroquine as a quote-unquote cure for COVID. So some of the teaching points I've got below. The important context for this was amidst a time of like vast uncertainty, very charged opinions about how to respond to a global pandemic. And one solution came up, hydroxychloroquine. This is typically a prophylaxis used for malaria. It was observed in some treatments in vitro as binding to the glycoproteins, the little spiky protrusions on the virus. And so it was considered perhaps a viable way to prevent infection spreading once people had been exposed to the virus. And so again, amidst uncertainty and a lot of emotional charge, when we had different leaders advocating for the use of hydroxychloroquine, these Minnesota scientists collected a really far-reaching study, over 800 patients who had known exposures to COVID-19 and administered either a placebo or hydroxychloroquine, and then observed what impact that had on whether they began to show symptoms of COVID-19.
Okay, and with that, I will share my screen. And so this is our data set, incredibly simple data set in terms of structure. We've just got 3 variables here. Each patient in this study, each of the 870 patients is an individual row. This is I think a good example of data organized in tidy format, where each variable gets its own column. So the variables that were recorded were treatment, and it's either hydroxychloroquine or placebo. And then the other two variables are these new incidents of illness and side effects reported. And again, Blake has put the link to this in the chat. So if you are in front of you are in front of a computer most likely, but if you care to open up the data set, you can. So we can see, for each patient, basically what was their treatment? Did they get placebo or did they get hydroxychloroquine following their exposure to COVID? Did they contract the illness after they were exposed to COVID? And then did they experience any side effects from the treatment? So this, and I remember in reading this included a pretty wide ranging, it was a pretty good breadth of side effects that were included. So it was basically any side effects experienced were counted, and it's a binary variable, just a yes or no. So in looking at this, there's kind of two main questions we can look at with this. First we could get familiar with the data if we wanted to, say, just throw up treatment here and look at, how many patients do we have in each treatment. We can see we had 470 received the placebo, 415 received hydroxychloroquine. We can look at these kind of data in different ways. We could look at this, traditional bar plot frequency. And again, no difference here really. We can also look at these in these categorical bubbles where the area of the circle is scaled to the count. And these, by the way, these tend to magnify very large differences, but in subtle differences, they make them look almost imperceptible. And because the area of a circle does not scale linearly. And so the area of a circle, this proportion 415 to 407 is pretty similar. And so those circles look very similar. Okay. So going into this, one question you might have is, is the drug effective? That's the big question. We'll just jump right into that one initially. And so we'll look at new incidents of illness plotted against our treatment groups. And so when I add that on there, we can look at this and we can see how many samples were in each group. In the placebo group, 349 patients did not contract COVID, 58 did. In the hydroxychloroquine group, 366 did not contract COVID, 49 did. And so the kind of eyeball test on this looks at this, and you don't really see much difference. And I think the overwhelming story here is no difference between treatment groups. But I also want to show you another way to visualize that can control for the difference in sample size between the two groups, which again is a modest difference. But if we go over to graphs made with rectangles, so we're over here in graphs made with lines and dots. But if we go over here, we can look at this way. And one of my favorite ways to do this is go into the appearance menu and use a stacked bar chart, and then take that stacked bar chart and plot it out as a proportion. And so we can see these data like this. And I might even flip around my treatments and put treatment on X and new incidents of illness on there, and just look at these bars. And what's your first impression? Well, my first impression is that, these are not very different from one another. And it looks like, there were slightly more patients that contracted COVID in the placebo group than there were in the hydroxychloroquine group. But if we go and we run a statistical test on this, which I'm going to do over here, and we say, what's the probability of getting results like this due to random chance alone? And we're going to run a chi-square test of independence. It is testing to see if the frequencies of counts in these two across these two variables look like they're independent of one another, or if they look like they're related to one another. And when we do this, we get a p-value, a probability value of 0.30. indicating that, we would expect a difference between groups of this magnitude due to random chance roughly 30% of the time. And, the cutoff for making scientific conclusions is often 0.05. For making conclusions that affect human health as strongly as this one has the potential to do, the p-value threshold used is sometimes even lower than 0.05. And so in this case, I would say that it looks like no evidence or weak evidence at best that there's a difference between these two groups. One of the activity questions in this asks to also, put yourself in the shoes of a public health official. Maybe you're at the FDA or some other organization that's doing drug approvals. And another thing you have to consider, besides what the effect of the drug looks like, you also have to look at what the side effects are. And so I'm gonna add side effects as a variable, and I'm gonna swap out new incidents of illness, and I'm gonna substitute in side effects and look at side effects like this. And so now we're looking at different data, and here the story, looks to be a little different, and that the placebo group is showing a much smaller incidence of side effects. That's the teal band there is the side effects in the placebo group versus side effects in the hydroxychloroquine group. And so, you're also now you're weighing, whatever small difference you saw in the treatment against this larger difference in the side effects. And if we look at we run the chi-square test of independence again with side effects and treatment, and we get with that, we see the p-value is less than 0.01. So this means that, the chance of getting a difference of this magnitude in side effects is far less than 1%. If in fact there is no difference in side effects between the placebo and the drug treatment. So, again, the conclusion you would probably draw here is, well, it looks like we don't really have evidence that the drug has much effect, but we have pretty strong evidence that there's going to be a difference in the side effects reported. And I think these are, the evidence that the scientists actually use to kind of stop drug trials for hydroxychloroquine as a prophylaxis for preventing COVID after exposure. And so that's, how you'd break that down. This one, very different data in this case. This is all categories. It's all yes, no data versus, looking at numeric data and thinking about, range and outliers. This is looking at, it's, comparing these counts across these groups. But also I think a really interesting case where you're able to look at some data that, was collected fairly recently and had some real world relevance for sure. And a thank you to Blake, who tracked down these data, I think, pretty quickly after reading a newspaper article. I think it was weeks after this drug trial was released that we had this activity up on the website.
Yeah, well, COVID was inescapable at the time, so it felt like as we were working in isolated conditions, may as well throw it up.
Felt relevant. Yeah. Well, I guess I will see if there are any other questions or anything you guys would like to discuss. We, as a follow-up to this, we'll send you we'll point out all the collection of public health data sets that are in the resource library. So we'll give you links to all those if you want to go in there and play with those or use those in some future course that you teach. And then always invite you, if you have any questions at all about working with Data Classroom, either with you as an individual or as a school district or as a school, please don't hesitate to reach out to us. We would be happy to talk with you.